Was on mute there. Thanks everyone for joining us today on this Friday afternoon for our February Source Partner Panel. This month's focus being on promoting mental health and well-being in Baltimore City. And before we jump into our panel presentations for today, we just want to take a moment for a couple acknowledgements. We respectfully acknowledge and give thanks to the Piscataway tribe, including the Piscataway Conoy tribe of Maryland, as well as the Cedarville Band of Piscataway, the indigenous people who are the traditional owners of the land of the Chesapeake Bay region. We also acknowledge all indigenous people, the traditional owners of the lands and waters of the United States of America. We also acknowledge the impact that racist systemic oppression, including the practice of redlining, has on the lives of Black and Brown folks in Baltimore and beyond. A little bit about Source. My name is Katie Nelson. I have the privilege of being one of Source's program assistants. Source's mission being to engage the Johns Hopkins University health professional schools and the Baltimore communities in mutually beneficial partnerships that promote health and social justice, with their values being reciprocity, justice, service, and collaboration. And today we are excited to have three amazing community partners with us: NAMI of Metropolitan Baltimore, Total Healthcare, and Robertas House. So we'll hear from each of them. And then we also have some students from the Mental Health Grad Network that will speak as well. So I am going to turn it over to Sarah from NAMI, and we'll hear from her next.
Cool. Thank you all for being here today, and thank you, Source, for having us, Katie, and your team. I'm really grateful to be a part of your network. If you guys are unfamiliar, NAMI stands for the National Alliance on Mental Illness. I have some slides here. I'll just go through them fairly quickly. There's a lot of words on them, but so NAMI is a national organization, but we are the local Baltimore affiliate here. So that means that we serve Baltimore City and Baltimore County, really serving those with a mental health condition and their family members. And really our goal is to provide support, education, and advocacy for those populations. Here we have our mission statement, very similar to what I just said. NAMI Metro Baltimore improves the lives of individuals living with mental health condition, their families, and communities through education, support, and advocacy. We do that through a few different avenues, I would say. In terms of education, we do hold education programs. We run them quarterly. They're 8-week courses called Peer-to-Peer and Family-to-Family. They're completely free for community members. The peer-to-peer class is for individuals living with a mental health condition, and they're led by people who are also, all of our volunteers are also have that lived experience. And so it's a really safe place for people to share about what they are experiencing. It's a place to learn about how to cope with your mental health condition, how to navigate resources, all kinds of things like that. Our next class is going to start April 24th, the 23rd for family and 24th for peer. They're going to be from 2 to 4 p.m. on Saturday and 4 to 6 p.m. on Sunday. You can register on our website, which is just namibaltimore.org if you're interested. And we do also have a course called Basics that you can find on demand on our website as well. That's specifically for parents and caregivers of children living with behavioral health conditions. Another way that we support mental health in our community is we host, again, free support groups, both for peers and family members living with a mental health condition or supporting someone with a mental health condition. These are led by trained facilitators who have that same lived experience. We really want to create a space for people to connect and feel like they are in a place with people who are living in similar situations with them. Maybe even if they don't have the same diagnosis, they have a similar experience. And so right now, all of our groups are meeting virtually on Saturdays and Wednesdays for peer support groups. We specifically have a young adult support group that is on the 2nd and 4th Wednesdays of the month. And then our family support group meets on Thursdays. And again, you can register for all of this on our website. We also do several presentations in the community. I thought I would just highlight these super quickly. just because these are all ways you can also volunteer, which I'll get to at the end, but we do Ending the Silence, which is specifically for middle and high school students, staff and faculty at their schools, as well as parents and families in the community. It's specifically geared towards talking about youth mental health, really trying to end the stigma, start a conversation. And then similarly, in our own voice, we do it at with all kinds of different audiences in the community, from the police to inpatient units to other nonprofits, really just whoever requests it. And again, the purpose is to really just start a conversation about mental health and really use the power of stories to share and really, again, start that conversation. So we also do work with every college campus in the Baltimore area for an I Will Listen campaign every year in October on college campuses. And really it's just promoting, talking about mental health awareness, and really opening that conversation on campuses. We also do I Will Listen for companies, and we do compassionate care provider training as well. You can reach out to us about all of this. I'll give our contact information at the end. We also host virtual voices. It's an auditory hallucination simulation. Again, we do it with lots of different audiences in the community, from the police to even we're working with Art with a Heart, and we're going to do it with their students. We do mental health forums every other month. And then, yeah, we are having a faith conference as well in May. We also do rapid referral, which is, we allow certain organizations will release their patients' information to us, and then we'll contact them. We also, kind of the opposite way, have a helpline where people can call us from 9 to 5 Monday through Friday, and we'll provide support. And we do advocacy as well on the state level. Every February we have Advocacy Day. It just happened a few weeks ago. It was really fun to see. It was on Zoom, which of course is not the same, but it's really fun to see people sharing their stories, legislators listening, and really seeing. There's a lot of really important bills happening right now, so that was really encouraging to see the work that's being done on the legislative level. And really, I share all of this because, and I really want to honor too, that our volunteers are really the backbone of our organization. We couldn't do any of this work without them. In the fiscal year 2020, our volunteers served over 2,500 hours supporting our community. Really, it's a great way for people to be involved, and to really, I find a lot of people want to give back after they are in a good place with their own mental health condition or their family members. And so if you are interested in getting involved in volunteering, you can always email us at volunteer@namibaltimore.org, or if you scan that QR code real quick, it will take you to our website, our volunteer application website. So I'll leave that up for a second. And then, kind of lastly, these are just ways to connect with us. Again, our helpline is open 9 to 5 Monday through Friday, and that's available really to share any kind of resources. Yes, we share mental health resources, but we also share things about housing or legal services or whatever people are calling for. And then you can follow us on social media. We're pretty active on there, and that QR code will take you to our website with all of this information as well. That's about all I had. Thank you guys so much for listening. We are really honored to be a part of this group, like I said, and are excited about the work we're doing in the community.
Amazing. Thank you so much, Sarah. I think we are still waiting on our presenter from Total Health Care. Kelly, would you mind going next?
Okay, good morning, everyone. Can you hear me?
Yes.
Okay, because I'm having computer issues. So I had to go from the computer to the laptop. So hopefully this is fine. So I would like to thank Katie for having me this morning, and nice meeting all of you via Zoom. Hopefully one day we'll be back in person real soon. But my name is Kelly Brooks. I'm the volunteer coordinator at Robertas House. And for those of you that don't know, Roberta's House is a family grief support center. We support children and adults that have lost a loved one to death. So our mission here is that we believe children and families that have suffered the loss of a loved one should have a safe place to heal and recover. And Roberta's House does address grief as a public health preventive service. So we really think it's really important to address grief, because if you don't unaddress grief, just turns into a lot of other things that aren't very healthy. So we do have over 13 support groups, and like NAMI, we depend on our volunteers very heavily. Even through the pandemic in 2021, we had over 100 volunteers, and they donated, serve families in the community, serve children. We have a camp we take in 2021. We had a one-day camp. This year we'll be having a 3-day camp. It will be held August the 12th, 13th, and 14th. So we take 60 kids and 30 volunteers. So our volunteers at Roberta's House play an intricate part in everything we do, because we're a very small staff. So they facilitate and co-facilitate our support groups. They help with the office day-to-day operations, health fairs, and fundraising. So we, again, like NAMI, heavily depend on our volunteers. Like, we could not do the work we do in the community without our volunteers. We're in over 13 Baltimore City schools.
Kelly, can you turn your video off? Your audio is cutting out a little bit. Just try turning your video off so we can hear you a little better.
Okay, is that better?
Yeah,
okay.
Try that.
Okay, so we are in over 13 Baltimore City schools. So we have 8-week and 10-week groups in the schools, and the kids are the kids that participate in these groups are selected by the social workers and or the principal. And so we just have abbreviated support groups for them, hopefully helping them to cope in a positive way. We teach them healthy ways to cope with their grief and to deal with their grief through art-related activities as well as written activities. We really stress journaling. And for the younger kids, like I said, we do a lot with art. And it's really important that they can draw out how they feel, especially if they're younger. Like, we call them the kiddos. So the kiddos here are ages 5 to 8. So we serve families and children ages 2, starting at age 2. And that group would be Rays of Hope. So Rays of Hope is really unique because they deal with families and children that have lost a loved one through homicide. So we know that at a very early age, grief impacts children at even the age of 2. So we do serve children 2 and up in that support group. The rest of the support groups, the children have to be 5 and older. So yes, so we have a lot of volunteer opportunities. Our next training is coming up in April. It's actually April 28th, 29th, and 30th. That's a Thursday, Friday, and Saturday. They are 3 8-hour days. And right now it's going to be in person. However, we have to take a pulse on what's going on with, COVID. But if not, it will definitely be virtual. So we have been doing both virtual and in person. Hybrid, I don't really like doing hybrid because with me, I think I tend to forget the people that are online. So I don't think they get the full attention as somebody in person. So I like to do it either virtual or in person. So it will be one or the other. You can always visit our website, www.robertashouse.org. If you need any other information, or you can reach out to me. My number here is 410-235-6633, and my extension is 106 if you have any other questions.
Kelly, would you mind putting that in the chat box for us?
Sure. Yep.
Awesome. Thank you so much. All right.
I'll put it in the chat.
Sounds good. And then our last presenter, we have Nicole from Total Healthcare.
Hi, how are you?
Good. How are you? Thanks for joining us.
Sure. I'm so sorry I was late. Things, you know how things go when you're supposed to be somewhere at a certain time. It never works out that way.
Did you want to take a few minutes and just tell us a little bit about Total Healthcare and any sort of volunteer opportunities you guys have available?
Sure. So Total Healthcare is one of Maryland's largest minority run nonprofit FQHCs, federally qualified community health centers. Our mission is to improve the health and quality of life of communities that we serve, and we actually have 8 locations. 7 of the locations we have are throughout Baltimore City, and we have one random location in Odenton, Maryland. I'm not really sure what the history is behind that. But I also like to note that we service all individuals, regardless of their ability to pay. Most of our individuals have Medicare or Medicaid, but some are on sliding scale, some have private. And I like that about our agency. Regardless of whoever needs help and their ability to pay, we're always available in the community. So we're an integrated care facility. We offer mental health services. We offer medical services. We offer substance use services. Like it's a one-stop shop basically for the community in Baltimore City. I am a psychiatric nurse practitioner. And I work specifically with children and adolescents. It's my specialty. I work in the CASH department, which is the Center for Emotional and Social Health. And they came up with that name because a lot of people don't like the name mental health or behavioral health. So it was used to kind of reduce the stigma that's related around mental health to encourage more people to come in and actually get the help that they need. We in the CASH department are comprised of psychiatrists. There are board certified psych nurse practitioners like myself. We have psychologists and social workers, therapists, counselors, everyone. And we recently, well, not recently, it's actually been almost a year now, opened our adolescent center at our Saratoga Street location in March of 2020. The program is 100% focused on children and adolescents and their mental and behavioral health. We do have, like myself, other clinicians that are specialized with children and adolescents, therapists specifically, and their specialties include everything from trauma-based therapies to ADHD and impulse disorders, everything that you can imagine. We did have groups in the past, however, with the pandemic, it's been really very difficult to try to get the groups back up and going, but it is something that we are looking for in the future. Our psychiatry department for CASH focuses on, psych evals, medication management. We do some autism spectrum disorder stuff, some education, and we collaborate a lot with Baltimore City school systems and even the county school systems in some instances, and also like medical professionals like in and around the city. We actually are new to SOURCE this year. We have a SOURCE scholar who is helping us with a community assessment right now. And I was actually talking to Rosemary yesterday, sort of like for next steps after the SOURCE scholar is done, because being that we're a new organization, well, not new, but our department is new-ish, and we're still growing. We're sort of looking for volunteers that can sort of build on what is currently being done, the work that our Source Scholar is currently doing. And that would be to sort of locate and foster relationships with other community organizations in and around Baltimore that service the youth population, so that we can sort of have that collaboration and within the community.
Very good. Awesome. Thanks so much, Nicole.
Uh-huh.
And then last but not least, we have a couple students here with the Mental Health Grad Network. Luke and Michael, if you want to take a few minutes to share what's going on.
Yeah, absolutely. I'm going to share a couple of slides and Michael will kick us off. Briefly, I'm Luke. I'm a third-year PhD student in the Department of Mental Health, and I've been working with the Mental Health Graduate Network for a couple of years now. And I'll turn it over to Michael to introduce the group, if everyone can see that all right.
Yeah, so hi everyone, my name is Michael. I am a first-year master's student in the Department of Biochemistry and Molecular Biology at Bloomberg. And I just joined this last year. Well, obviously it's my first year, so I just joined, but I'm already finding it to be a very rewarding experience. The purpose of our organization is to kind of connect all of the departments at Bloomberg with a standard culture of mental health and to improve student well-being and awareness of mental health issues in the community. So part of that is kind of getting input from every department. So we have members from, I'm pretty sure most, if not all, departments. And each of them brings their own perspective and their own ideas. And it's very helpful to hear from, different niches within the Bloomberg School, just because sometimes we can get very isolated in what, one department or another department might be. So it's always great to hear from other voices. We are always driven by focusing on the best mental health practices. So we are very data driven. We're very, efficacy driven. We want to make sure that what we are doing actually has a discernible impact on our students and our faculty and staff. And then we also maintain a repository of strategies. So one example is we're currently working on a faculty presentation that we could offer to different departments that would enable them to kind of connect with different resources or connect their students with these different resources. And then Luke, if you could go to the next slide, I did want to talk a little bit about just what we're doing with COVID. So part of what kind of I personally want to work on over this next year is as we kind of, I don't want to jinx it, but as we're kind of coming out of this pandemic, we want to recognize that people are going to have different varying levels of anxiety, depression, especially as we kind of come out of what we've really become used to over the last 2 years. And we want to make sure that both students and faculty feel supported, and that, we don't want to feel like they're being forced to do anything or like we're moving too fast. We understand that people are going to kind of come out of this at their own rate. And I've identified that as kind of one of the main things that we want to focus on. But Luke will talk a lot about our other projects. So I'll hand it over to him.
There we go. I will forever be learning how to navigate Zoom a few years into this, but thanks, Michael. So I want to talk a little bit about some of the other activities and then about how to get involved. So every year we work with NAMI Metro Baltimore, and Sarah, it's nice to virtually meet you. We've worked with Jamie Clark over the past couple of years, and to bring their I Will Listen campaign to the JHSBH campus. And in 2019, we had a great in-person event. We had vendors from the community, artists from the community come, and food and different booths and tables set up, and we had student performers even. So that was really great. And we like Michael said, I'd hate to jinx anything, but we hope to have those sorts of events in the future too. Hopefully for Iowa and Melissa week next year. And Michael had alluded to some of the trainings that we've put on and helped with and planned and implemented. So one of them was the In This Together workshop for the COVID mental health task force that the school put together. And in 2018 and 19, we helped craft syllabi language for mental health resources for students that is now in place. And Michael had mentioned some of the faculty workshops, so we're working with Dr. Jackie Stone in the Office of Student Health and Wellbeing to, we had these workshops we were putting on before COVID, and so we have sort of the tools, and we have surveys to send to faculty and staff before and after, for example, to gauge engagement. And so we're working now on building those in a more sustainable way with the school. We've put on sort of smaller kind of fun events. So one recently was called Pause for Pause, just simply a open social space, safe space for students to come before finals kickoff and relax, grab and go treats. We had Elf on the big screen, and we had a service puppy there. Daisy was there, and nice place just for students to kind of hang out and take their minds off of school. And we recognize with COVID that's not always easy to find. And then this year in May, we hope to put on a film screening for a film, or rather a series of films put together by Wendy Ingram, who was a postdoc in the Department of Mental Health and one of the co-founders of the group called Breaking the Stigma, which features faculty and staff testimonials from the school about their own experiences with mental health and in breaking the stigma. So we are sort of always seeking new members, and anyone affiliated with JHSPH and students, postdocs, we'd love to have you join the group. And there are different levels of membership. So listed at the bottom, a volunteer member would join our group. We do all of our communication by Slack, and certainly join our monthly meetings. And then sort of, you can be as involved as you'd like. We understand we're all students. We all have a lot going on. We'd like to volunteer and kind of do our part, but there's other stuff will come up. And then there's the core member, which we try to have 2 core members per department, and these are the ones who will sort of spearhead our initiatives and events. And then we have about 5 executive board positions as well. So we will be having elections in April too. So if this is something that right off the bat you're thinking you'd like to get more involved with, please shoot us an email to this address here, and I'll pop it into the chat as well. And thanks again to the Source team for giving us this opportunity to share with everybody. And it's great to see all the other work and volunteer opportunities going on.
Wonderful. Thank you so much. So now we have some time for questions. And I know we had a question from Harshini in the chat about mental health resources to provide to the Baltimore people. And I saw Nicole and Sarah have responded as well. Kelly, I don't know if you saw that. What sort of resources Roberta's House might have available for people who needed sort of mental health resources? Would the best way to learn about that be to visit the website, or?
Yes, you can visit the website. And we do also have, so I did forget to mention that our services, let me take my face off so you can, oh, I did, okay. Our services are free. So all of our support groups are free. However, we have started another component that we do have a staff that licensed therapists. So we do have a component where people need other services such as one-on-one. We do have the ability to service them now. So we've had a overwhelming response to this group, because just like Michael mentioned, everybody's coming out of this pandemic, and it's like you have to readjust now. So we do have services for that. So they can just call Janae, his name is Janae Stanley, and I'll put that in a chat as well. So Michael, you can have your people reach out to her.
Okay. Thank you. Does anyone else have any other questions for any of our panelists at this point? Otherwise, I'm going to dive in. So I know we've sort of alluded to, and without trying to jinx anything, given where we're at with the pandemic, I would love to hear from each of our panelists how you have seen, the impacts of COVID-19 on the populations that you serve, and how you've had to sort of pivot to continue meeting the needs of your clients during COVID-19.
Okay, so I'll go real quick. So our clients, like I mentioned before, we've still been able to serve the families and children that need support. However, the plan was to be in person, so they still have a lot of anxiety about being in person and being around other people. So our support groups did not start in January in person. We're still doing them via Zoom. And I think just getting people comfortable with coming out and being around other people and trusting that, vaccinations work. Everybody's hearing stories about, I've been vaccinated, but I still got sick, and I guess just getting people to get to the level and to the being comfortable enough with coming out. So as far as we've had a lot of requests to do a support group just for families and children that had lost loved ones to COVID. So that's another anxiety we having. My mom caught it and she passed, so will I die from it? So we've had those types of conversations. So it has definitely impacted the community, in ways I guess we never thought that it would. So yes, but that has definitely been a request to do a support for loved ones that families that lost loved ones to COVID. So that's works now.
Yeah, I'll jump in too. I think very similarly, like people have alluded to, I think like through COVID, we've seen such a stark increase in anxiety, depression, all these sorts of different mental health things going on. And, even if someone doesn't end up having a diagnosable condition, these are symptoms that we're all experiencing on some level. We have seen a huge increase in our attendance to our support groups, both the peer and the family side. I think, to be honest, pre-COVID, the attendance to our family support group was a little, you never know what's that you're going to get. Now we've got a really consistent group going every Thursday night. When COVID did hit, back in 2020, we went entirely virtual. And that definitely was a shift, I think, for our participants, for our volunteers. But we were virtual completely for our support groups, classes, everything. For, I guess, over a year, we came back partially in person in the fall, doing every other week, like 1 week virtual, the other week in person. After the holidays, we went completely back virtually again, but we are hopeful to be again partially in person in April, hopefully. I think I think like everyone's struggling with right now, there are pros and cons to both. There's pros to being in person because the connection is that much deeper. There are pros to being online because it's convenient for people. So it's definitely something we're still navigating, but I think there's such a need now, and I think mental health is at the forefront of so many conversations. And so we've seen such an increase in even our volunteer corps, our services, our attendees. There's a great need, and we're trying to meet it.
Just to piggyback on whatever everyone else is saying, we also have seen a dramatic increase in the need for mental health services and total health care. And being that we're an integrated care facility, when someone comes in for primary care, they're screened automatically for mental health services. So we've gotten an influx of referrals and walk-ins as well. But what we've really seen an uptick in is the child and adolescent population as they're returning to school after, a year and a half. You're seeing the anxiety, you're seeing the depression, you're seeing some of the adjustment stuff. So for us, we also use telehealth like so many other centers have been using, and it has been very helpful, especially through the initial parts of the pandemic, to make sure that the treatments continue to be ongoing. So we utilize teleaudio, televideo, and it's getting to the point now where people are starting to return in person, because especially for children and adolescents, while teleaudio and televideo it's great and convenient, they don't always feel the privacy that they can get with in-person sessions. So we're starting to see a return and being more comfortable with coming back into the office.
So it sounds like kind of across the board, mental health, I feel like in some ways, it's good that we're starting to center this as being, sort of something that we need to address, but definitely keeping up with the influx, it sounds like is a big challenge. Are there any specific orientations or trainings required for volunteers at your organizations, especially if they are going to be working with youth?
Yeah, I can jump in there. We definitely have, we definitely have trainings for all of our different, all of the different ways to serve. I didn't mention this in my presentation, but you can do anything from answering our helpline to, being a support group leader. And there are trainings for both of those. We're not just going to throw you in there. We know that there's a lot of nuance, I think, to how to facilitate a group and all those types of things, even how to answer the helpline. So there is training specifically for whatever avenue you do want to volunteer with. And we'll get you set up for that, and especially, our youth program as well. We do presentations, as I mentioned, Ending the Silence in middle and high schools, and there's training for that. We are here to support you throughout the way and make sure you feel equipped and prepared to serve our community.
So I'll go. Like I mentioned before, all our volunteers go through 24-hour training. Once they decide what support group they want to volunteer for, excuse me, the program manager for that group gives the volunteers an onboarding overview and training, just letting them know what their duties will be, what they'll be responsible for that 8 to 10 week group. So like Sarah mentioned, we are just here to support our volunteers. We have ongoing trainings through the year. So we try to do 4 volunteer workshops, one each quarter, and it may be around grief, or it may be a totally different topic, which could lead to grief. So we try to keep them involved that way. And we also select one volunteer to go to like a national training, so abroad. So hopefully we'll be able to do one this year, because starting to open back up. But like the NAGC, they have a conference every year. So this year we're hoping that we can send a volunteer along with some staff to that. And then the volunteer, they have one for the volunteer Points of Lights. So I go to that one every year, and we'll be sending a volunteer there as well.
Nicole, did you want to add anything?
Sorry, I forgot I was muted. We have just our HR onboarding process that we use for volunteers, and a lot of the trainings do include things specifically for working with youth, but no specific training necessarily outside of that we use, not at this time anyway, but I imagine that at some point we will, because the Adolescent Center is growing.
Awesome. And do you know if there would be specific trainings involved for anyone working with the youth and adolescents in that specific setting?
As of right now, no, it's just
Okay.
what's on the onboarding for our HR.
Okay. So this type of work, we know it can be heavy, it can be hard. What gets you all out of bed every morning to continue doing this type of work?
Okay, I'll go. So I think for me, having experienced my own losses and understanding how grief impacted my life, as a young adult, I really couldn't imagine how kids kind of, process and go through this. So I think being in a position to help children and adults navigate through their grief journey in a healthy way, and having them see that, while grief can really be traumatic, really good things can come out of your grief, such as Roberta's House, such as other foundations and things like that. So just being in a position to help them see, I guess, the brighter side and giving them healthier ways to deal with their grief. So that helps to get me here, and my volunteers. Like we definitely a great group of volunteers that make the work I do here much, much easier, and they make my life much easier. So that helps as well.
Yeah, I would say for me, can be really hard and really heavy work sometimes. But in my role in particular, I'm a volunteer and outreach manager. So that means I do all this work of onboarding all of our volunteers. And as I've kind of mentioned, most of our volunteers have that personal lived experience story. And just on a personal level, I think story is really powerful, and hearing people's stories. When we have volunteers coming to us, it's usually because they're living well with their mental health conditions. And so it's actually really encouraging to hear, what somebody has gone through, but then where they are now, and then they're in this place where they want to give back. That is really powerful to me and really encouraging. And so I don't know, I think like just hearing people's stories is what gets me out of bed, and continuing this conversation. I think moving things forward is really exciting to me. Continuing to bring mental health to the forefront, and really, as we said, like really ending the stigma around that.
So I have a personal connection to Baltimore. I was born and raised here. So I've always wanted to be able to give back to my community, especially with all the deeply trauma-based situations that we have here now with the youth. But prior to becoming a nurse practitioner, I was a psychiatric nurse, and I worked in so many different settings. And I saw so many instances of little Black and brown kids who were misdiagnosed and over-medicated. And there was not really anything that I could do except for advocacy work at that time as an RN. So I decided to get an advanced practice degree so that I could sort of do a bit more, be heard a little more effectively, to continue to work with the population. So that's what gets me up every day.
That's amazing, and so great to hear about sort of the uplifting and on a positive. All right, I'm going to share my screen. Just a couple housekeeping things before we wrap up today. All right, so I want to take one more opportunity to thank all of our presenters that were here today. And again, Azat put a link in the chat where if you're interested in getting connected with them, you are welcome to put your information in that document. As always, we encourage everybody to follow Source on social media to stay connected on all of the different offerings that are happening. If you are interested in getting connected with any of our panelists from today or any of our other community partners, you are always welcome to email us at source@jhu.edu. And we also have virtual office hours every week where you can sign up and meet with someone from our Source staff one-on-one to figure out what the best sort of opportunity for you is and get involved with the community. And then lastly, we hope that you all will join us in March in just a couple weeks for our next partner panel where we will be focusing on housing, homelessness, and related advocacy efforts in Baltimore. And that'll be Tuesday, March 8th from 12 to 1, and we'll be online through Zoom again. So with that, I think we'll gift everybody a couple minutes back before the top of the hour. So thank you everyone for being with us today, and stay safe and take care.
Thank you. Have a good day.
Thank you for having us.